Scientific literature. Obeying guidelines. Clinical usefulness of Spanish gastroenterologists' adherence to gastroesophageal reflux disease guidelines. Aim: to investigate the usefulness of adherence to the gastroesophageal reflux disease (GORD) guidelines established by the Spanish Association of Gastroenterology. Methods: observational prospective multi-center study of 301 patients seen in gastroenterology clinics with typical symptoms of GORD and eligible to be managed according to guidelines. Patients were eligible for inclusion if they had typical symptoms of GORD as their main complaint with or without accompanying atypical symptoms. The Spanish Clinical Practice Guidelines for GORD, a well-known and widely accepted management tool among Spanish gastroenterologists, contains specific recommendations on all diagnostic and therapeutic decisions for these patients. Results: an endoscopy was ordered for 123, 41% patients. 50 with alarm symptoms and 32 without alarm symptoms but aged over 50. In the presence of alarm symptoms, endoscopy was ordered in 98% of cases, consistent with recommendations. Adherence to guidelines for proton pump inhibitor (PPIs) therapy was 80%, but doses prescribed were lower by half in 5% of cases and doubled in 15%. Adherence to guidelines regarding duration of PPI therapy was 69%. Duration was shorter than recommended in 1% of cases, or longer in 30%. Treatment response was higher when PPI doses were consistent with guidelines, although differences were not significant, 95% versus 85%. Conclusion: GORD guidelines compliance was quite good, although endoscopy was overprescribed in patients over 50 years of age without alarm symptoms. PPIs were prescribed at higher doses and for a longer duration than recommended.